Hello there, my name is Martin Ciupa. I am the lead of the data science team at the AAPM. Prior to discussing the goals and opportunities that we feel that we can bring to bear in the fight against coronavirus, let me talk a little bit about my background. I was the Chief Artificial Intelligence Officer of MindMaze, a Swiss unicorn working in the area of neurotechnology for rehabilitation. Prior to that, I was the Chief Technology Officer of a US-based corporation in robotics, and I have had a career over 30 years in AI as well as in data science, both in terms of technology as well as business. So I hope to be able to bring both of those skill bases to bear on the problem of our day, which is, of course, coronavirus. In many respects, it's the biggest problem we've ever encountered. Certainly in the opportunity to be able to do something which will mitigate a potential disastrous circumstance around the globe. So with that in mind, I have a focus to lead the team at the AAPM Data Science Group to look to short, medium and long-term goals. And there are a variety of opportunity that AI can bring to bear in those areas. In the short term, we can use some of the successes in deep learning to be able to do accurate and precise diagnosis of medical images to help diagnose and understand the state of a patient's prognosis. This is of significant help. Furthermore, there are a range of technologies from chatbots, and I'm working with one such company called Mental Imagery at the moment, as well as concepts like blockchain, where we can bring the ability to provide secure communications and to be able to do financial transactions in ways which are fast and, as I say, secure, to enable patients who need to pay for treatment to do so in an effective and expedite manner. And I'm working with a company called KimboCare in that area as well. But in relation to what AAPM can do, there are some really good long-term opportunities. And we start by collecting data. As I said, I'm based out of Switzerland, and the World Health Organization is very close to me, as is the United Nations. And I've presented to both organizations in topics in AI and healthcare. So I have a good network. I am bringing my network to encourage significant players to join us so that we have a team which is world-class and able to produce results which will have impact and mitigate the worst-case scenarios that we may face. That is in diagnostics, therapeutics, as well as in discovery of drugs which can help to alleviate and help patients recover from their symptoms. And perhaps in the near-term future, to be able to discover new vaccines, to be able to prevent not just this iteration of a plague on mankind that we've had to suffer throughout our history, to be able to detect pandemics whilst they are epidemics in small clusters, and to be able to act in an evidence-based scientific way to prevent the spread of these epidemics, to prevent them becoming pandemics, and to discover, as I say, vaccines that will inoculate the population and relieve us of the pain that we may have to go through. But before I finish, I want to end on a positive note. The world in which we have living, which has allowed these circumstances to occur, is not the world we will live in 5 to 10 years' time. Technology such as AI can make contributions so that our children and grandchildren will not have to suffer in the way that we may have to suffer over the next few months. We are looking to be able to make a genuine, real impact to improve the quality of our lives. And I encourage you to join with us at the AAPM and work with us so that we can achieve that vision of where we wish to be. We shall persevere. Thank you so much. Bye-bye.